Hi there, welcome back. Today's show is all about making things just a little bit better. Do you or someone you know suffer from chronic pain? Well, you may not have to. There is help out there, and Dr. Doug Yeatman from the aascend Pain Institute is here to talk about relatively, I think this is relatively new, just all different, well, first of all, good to see you, Dr. Yeatman.
Hi, good to see you again.
And your office is all about all sorts of pain relief and
Correct.
all different, whatever it takes, you come up with solutions.
Correct. We think outside the box, so that's the fun thing about my job. It's always about bringing pain down. Today we brought some more stuff on spinal cord stimulation for chronic pain.
For chronic back pain or neck pain?
Any kind of pain. Usually it's like if you had surgery because of a bad disc and it pinched the nerve. Okay, they fixed the disc. Now you got a damaged nerve. Now you got a lightning bolt going down your arm. You got a lightning bolt going down your leg. And that's hard to treat. Nerve pain is very hard to treat. So these devices have been around since the 70s,
okay,
but they've gradually improved. This is the new fandangle one that came out in the market a few years back, and it's kind of fun. A lot of the programmers that we've been using, you always have to have an antenna over top the battery and stuff like that. And it's a similar battery. These little batteries, this is like a pacemaker battery that they put in. They're very small.
Yeah, and it's not heavy or anything like that.
And they're rechargeable.
Wow. So explain to me how this works. So somebody's suffering from pain, and they're tired of taking all sorts of meds that make them, loopy, or they're looking for other options. They come in, you try this out.
We try other things first,
okay,
but this is down the road. So we're masking the pain.
Okay.
Okay, so what this device does, it's got the little model here. These little wires we put in next to the spinal cord. It's hard to tell, but these little wires sit next to the spinal cord.
Now, that takes surgery to put those in?
Well, we do trial to make sure we get the right spot.
Okay.
That's a little mini surgery. You put a little needle, slide these in. And this is what they look like. This is a little electronic little wire.
Teeny, yeah.
So what we do when we have it in, we turn certain leads on, and that gives an impulse on the spinal cord, and the patient feels tingling in that area, like your foot would tingle, your leg would tingle. So you're masking the pain. You turn it off, you get the pain back.
Oh, interesting.
So it depends on where you put it as to what kind of pain relief you got. Now, a lot of people put these in, and I've been finding out a lot that people have them in, just doesn't work.
Right.
I come on in, we reprogram it first thing, try and get it, and I fix them. So they work fantastic. So they have to just be in the right spot and working right. So the big thing to do is programming. Now, the reason I brought this device in, this is the new programmer. It's been out for a couple years, but this is neat. A lot of times with the programming, they'll have the doctors be sitting there and going, okay, where do you feel it? Try this. And the patient just, left toe, right foot. Can't really get it.
Yeah.
This is more patient interactive. So what it is, the patient will be turn it all on, and this will be the area for the back. And it's just like a Game Boy. They'll turn the volume up, left, right, make the stimulation go to where they want in their body. Takes the whole guessing out of it. They actually feel where they're going for it.
Interesting.
So on one of our videos we had, the lady, we just revised an old system for this, and she's using this. She thought it was amazing because she could put it right to her foot.
Wow.
Real quick. Right. Whereas before it took a half hour. No, it's not quite there. You're guessing where to go.
Right.
And she turned it on, just went to town, and got it right down to her foot.
Interesting. So what's going on here?
This is actually one of the trials we did for actually putting one in. So it's a mini surgery, but once again, it's just a small little needle. You put it into the epidural space, and you slide the lead up. Take the needle out. The trial is temporary. It's anywhere from 7 to 10 days. Some people do it for a month, so about a week.
Okay.
And then throughout that week, you program it, try to get better coverage. And you want to get good coverage from the trial. If you don't have good coverage in the trial, the permanent's not going to work either.
Okay, right.
So it sort of tells you if it's going to work well.
Right. But if you're having good luck.
If you do well in the trial, excellent. Then the same thing for the permanent, except everything goes underneath the skin. The battery is a rechargeable battery, gets put underneath the skin. This little device right here is the recharger, and all you do is wear it in a little pack on your skin above the battery.
Wow. We're running out of time. Results, amazing?
Amazing. A lot of patients love this stuff, especially the patients who've had them in before. We come back, revisit a little bit, change program or change the leads. Couldn't believe how the difference. They love it.
Wow.
So
very cool. Who knew?
Oh, this is fun.
Neat stuff. Exactly. If you have any pain, talk to this guy. He may be able to help you out. Dr. Doug Yeatman, aascend Pain Institute. Good to see you.
Good to see you. Thank you.
Thanks.